have a vaccine to prevent many cancers. Why aren't we doing a better job of vaccinating adolescents with the HPV vaccine? In part, we're not vaccinating because of misinformation, and that makes me very angry because misinformation costs lives. But as I said, anger alone doesn't do anything. So I want to talk to you briefly about the virus, the vaccine, and some strategies that can help us increase vaccination rates. There are about 150 types of HPV, both high and low risk types with respect to cancer. About 13 types are associated with cancer. You can be infected with more than one type. Most sexually active individuals will be infected with an HPV during their life. Most individuals will clear the virus within 2 years. Most infections are asymptomatic. There is no treatment for HPV infection. If low-risk virus types persist, they can lead to genital warts. If high-risk types persist, they can lead to cancers. These occur in women and men. The burden of HPV-related cancers in the world is disproportionately higher in less developed regions. And in large part, this occurs because they lack cervical cancer screening programs and early intervention and treatment. There are going to be about 300,000 deaths from cervical cancer around the world this year, and 88% of those will be in developing countries. HPV is a huge public health problem. In 2006, we had the first of 3 vaccine options available to prevent HPV infection. The vaccines are all safe, and all 3 protect against most HPV-related cancers. 2 of the 3 types also protect against genital warts. The cost of vaccination can generally be covered by insurance or other programs. Overall, the U.S. is falling short of the 2020 goal of vaccinating 80% of 13 to 15-year-old adolescent girls, and coverage for boys is even lower. We want to vaccinate before children start to be sexually active. Why aren't parents vaccinating against HPV? Surveys show basically they either lack information or they're misinformed, or their doctors are not recommending it. An example of misinformation is the idea that HPV vaccination is an invitation for adolescents to engage in sexual activity. Research shows this is not true. If doctors don't appropriately recommend the HPV vaccine, it's a missed opportunity. We know that adolescents are visiting their doctors and receiving other vaccinations like Tdap, but they're not getting the HPV vaccine. If we could eliminate such missed opportunities, we could increase coverage to 90% for at least 1 dose of the vaccine. 3 are recommended. The CDC has identified strategies that can help us increase vaccination coverage. Partnering with community groups, comprehensive communication, reminder systems, and addressing parental concerns through education of vaccine providers. The goals for educating vaccine providers are to increase their knowledge of HPV-related diseases, increase their skills to develop strong and effective vaccine recommendations, and to decrease missed opportunities. The Minnesota Department of Health has developed a series of videos to help providers tell parents and their teens that the vaccines are safe, valuable, necessary, and effective. What else can the public health community do? We can use additional strategies to improve vaccine rates. We can promote reliable information to counter the toxic misinformation that abounds. And we can repeat the message that HPV vaccination is cancer prevention. And the vaccine is safe, effective, and important. And parents and healthcare professionals are key to protecting adolescents from HPV cancers. In summary, we need to educate and vaccinate. Thank you.